a chance to meet most of you sometime during today, but if you don't know me already, my name is Dr. Jessie Sanders. I am the owner and head veterinarian of Aquatic Veterinary Services of Northern California, out here in this part of California. I've been a ZNA member since this time last year. My business just crossed over its 1-year anniversary, so we're slowly working on building customers and just kind of getting the word out that we're here, we're available. So if anybody has any fish health questions, we're here to help. So today I will be delivering the koi health seminar on pathogen resistance. So if you guys can also wait and hold your questions till the end, conveniently they've given you little scribble pads, so write down anything you don't want to forget. So a little bit more about me, like I just said, I am the head veterinarian of a mobile practice out here in Santa Cruz, and our job is to take the stress out of keeping fish healthy by answering your questions, providing quality home care, and just helping wherever we can at this point. I'm a certified aquatic veterinarian by the World Aquatic Veterinary Medical Association, and I'm also a member of the American Association of Fish Veterinarians, which is also new as of last year. So if you haven't heard about it, that would probably be why. So first of all, we're just going to start with some very basics. What exactly is pathogen resistance? The phrase itself. So, what is a pathogen? Pathogen is defined as any disease-producing agent. So this could be viruses, bacteria, protozoans, worms, both in the bloodstream and in, say, the intestines. And then resistance, on the other hand, is the active power to withstand, resist, and oppose. So putting these together, pathogen resistance is a disease-causing agent's ability to resist, oppose, or withstand treatment. So you've probably heard a lot in the media recently about antibacterial resistant pathogens. So bacteria, there's some Aeromonas species that are highly resistant. So we're basically just going to go over how they form and how you can prevent them. But of course, why is this important? Well, as a veterinarian, pathogen resistance makes treatments ineffective. Something that may worked for a long time before just isn't working anymore. That's going to have to change our game plan, and we're going to have to look for different and novel treatments in order to make your fish better. This also leads to fewer available and effective treatments for you, the hobbyists, as well. And down the line, this can develop what we call superbugs, which are pathogens that are resistant to multiple treatments. So there's some that's resistant to salt and a bacteria, an antibacterial, and something else. So, starting out, what is used to treat pathogens? So it depends on what you got. Now, as you can see, it's basically putting anti in front of the word, and then you have your anti-parasitic, antifungal, protozoal, and antibiotic. So different drugs depending on what problem you have going on. Now I'm going to take the antibiotic example because everybody can kind of relate to that. So there are 18 different classes of antibiotics. And then from those 18 classes, there are hundreds of different antibiotics. And then these are used to treat different infections based on, in humans, where in the body they are, what is susceptible, and in fish it's kind of along the same things, except they're more a homogeneous pile. So drugs in the same class, going back to these 18 classes, have the same mechanism of action, how they work to disable a pathogen, and target spectrum. So what is a target spectrum? So this is used to differentiate between different types of bacteria that this particular antibiotic is effective against. So you'll have your gram-positives and gram-negatives, which is just kind of based on the outer coating of the bacteria. And then you have your aerobic and anaerobic bacteria based on if they use oxygen to survive or if they don't. So this would kind of be the difference between a microbe that lives on your skin or into your intestines. So just take a couple examples here. We have penicillins and cephalosporins, which are grouped together. They have the same mechanism of action. Sulfonamides or sulfa drugs, metronidazole, and then tetracyclines. So as you can see here, there's a good mix of spectrums. You have some that just do aerobic, some that have anaerobic, and some that do both. And then some of the others do a little bit extra. So these are bacteria that are not really classified. They're more kind of protozoal, rickettsial organism. So now we're going to look at the different mechanisms which make these different antibiotic classes work the way that they do. So penicillins and cephalosporins inhibit that bacterial cell wall creation, basically leaving a bacteria very vulnerable to the outside environment, which leads to more rapid bacterial death. And then sulfonamides will inhibit folate acid and nucleic acid synthesis, and this kind of just slows down the reproduction of the bacteria. So two different classes, two very different ways in the way that they work. And then we have metronidazole, which inhibits DNA synthesis. So this just makes sure a bug cannot possibly help itself out. Say there's a tear in its DNA strand, it can't fix it, it's just going to end up withering and dying. And then tetracyclines attack the protein synthesis required to make more cells. So we have 4 different antibiotic classes here that all work very differently. So the way a pathogen becomes resistant is by impairing its mechanisms. So figuring out a way around these mechanisms. So how does this occur? At the core of every pathogen is DNA or RNA. These are prone to natural mutations, which 99.99% of the time result in cell death. The cell will not replicate, that bacteria will be gone, that little change in the DNA will be no more. But sometimes these can be incorporated into the DNA, and it's in just the right spot where it'll make the bacteria or protozoa impervious to whatever antibacterial, antiprotozoa agent that you are using. They can also incorporate plasmid of DNA. This is a little ring of DNA. Bacteria switch them between each other pretty much all the time. They come into contact with each other. And this can have resistance mechanisms built in. This is kind of how bacteria survive in an environment that is hostile. So now we're going to take a sample of bacteria on a fish ulcer. So all these little blue dots is a different little bacteria colony. Now, over time, these little red ones, they're going to get a mutation that says, you know what, we're just not going to go on with this, we're going to die. So those cells just die. This keeps going and going and going. Well, let's say this one little yellow one here picks up a mutation where it is resistant to one particular type of antibiotic. So it's just going to hang out there. The little red ones are going to die. Over time, this is what your sample will start to look like. You'll have a few of those resistant colonies, but most of them will be just kind of hanging out there, not really having a problem. So say you treat with an antibiotic that, say it's an ulcer on a fish that's just being caused by poor water quality. Sure, you'll kill most of the bacteria on there, but you also now have these resistant ones that have passed the test. So instead of treating the primary problem of the poor water quality, these bacteria will persist and survive. So now there's more room. There's more nutrients for them to latch onto. So now new bacteria come in, and these resistant ones are able to populate some more. So then we go again. Sorry, this one's orange if you can't tell. So the red ones are the bacteria that have gotten a death mutation, and then the orange one has now picked up another plasmid for resistance. So it is now resistant against 2 different antibacterials. So then you treat again, but of course, if the primary problem is not taken care of, these bacteria will persist unless you dump pretty much a giant vat of antibiotics on a fish, which is probably going to kill the fish anyway because it's going to wipe out all the intestinal bacteria, all those good bacteria that help him digest. Not to mention, the treatment itself is going to be highly stressful. So what do you end up with here? You're going to end up with a highly resistant population that just kind of takes off. No matter what you do, those drugs that you dump on, these ones are going to sneak around. So all the other bacteria will be taken off, but these guys will persist in the environment. So let's just take some examples. If you've ever heard in the news about MRSA, this is actually the synonym, the anagram for methicillin-resistant Staphylococcus aureus. Staph aureus usually lives on our skin. It's on all of us right now. It is just fine. But it has been perpetuated in hospitals and continues to thrive. In these clean, sterile environments, these bugs are able to persist because they are resistant to so many different cleaning agents and drugs. So when a patient comes down with this, we get these in dogs and cats as well. you have to strictly quarantine this person or animal to make sure it doesn't get into contact with anyone else and spread further. Because in order to treat these, you have to use extremely potent antibiotics. And these are usually the ones they keep locked in the vault, only for the last resort. Like, nothing has worked up to this point, so we're going to go for the imipenem in the back vault, and that's pretty much going to wipe out every bug in your body. The recovery from these drugs is horrific, because it'll wipe out all your GI bugs, and it's not fun. So, MRSA bad. And then this is kind of new. Dogs are prophylactically treated for heartworm. Heartworm is a horrible disease in dogs. Basically, they actually have worms in their heart, which blocks blood flow, causes clots to go to different parts of the body. Cats can actually die from just one worm since they are so small. But what they have found is dogs that have been receiving the prophylactic treatment still come up positive for heartworm. So what does this mean? Does it mean we should stop prophylactically treating it? No, absolutely not. Because it is still killing all those worms that are not resistant. It may be breeding these superworms, but the risks associated with not treating this are just so much worse. So what they are working on now is developing a new medication that they can add to the current heartworm drug in order to target these resistant populations. So still needs to be treated, because if your dog gets a heartworm, that heartworm test, just a blood test, if it comes out positive, that's going to be a very costly and dangerous treatment, because they have to kill the worms that are in blood vessels and make sure that those don't clot any vessels further down, and that the dog doesn't go into shock just from having all those toxins released in its bloodstream. So, how do we prevent this? Only use antibiotics when prescribed. Now, I know they're available online. I know you can get them without a veterinarian. By law, I cannot give it to any of my clients unless we have a valid veterinarian client-patient relationship. So I can't give it out over the phone. I have to meet the client. I have to examine the fish and test the water, because antibiotics are great, but they're not magic and really need to be treated with respect. So first things first, always know what you are treating. It's not really worth your time and effort to throw away money on ineffective treatments. If you're not really experienced with koi up to this point, there are lots of people in our community, within our club even, that have very good experience working with fish that are sick. So if you can't get to a vet, there are many koi health specialists that can help you out, at least make an educated guess as far as treatment. And always treat the primary problem. Secondary problems will continue until you take care of the first thing. So my favorite example is a fish with ulcers. Probably 98 to 99% of the time, this is not a primary bacterial problem. There's usually something else going on either in the water, or there is some other source of stress that is making this fish break out in ulcers. So we'll go over a couple examples of these too. And then when you're going to go treat, use the narrowest spectrum possible. If you are able to, say, get a culture, you can do a resistance test. So this resistance and sensitivity. So this will show you exactly what antibiotics this particular bug is sensitive to, and then treat using that. And that will keep our superbugs at a minimal, take care of it in the first shot. You don't have to worry about it coming back. So, heard this a lot. I know I need an antibiotic. Where do I get them? So, wait just a minute. I urge you not to jump straight for the antibiotics. Just because it worked before or worked in your friend's pond doesn't mean it's warranted every single time. If I'm not going to give it to you, don't panic. That means that there's something else that is easily treated that we can work towards, and then you don't have to expose your fish to an antibiotic. So they should really only be used as a last resort, not the first. So now we're going to go over a couple cases. So our first koi with a skin ulcer. We have a 12-inch koi that had an ulcer on the right side of the abdomen for the last 2 days. 2 days later, we see 2 more koi with ulcers. They're eating well, swimming normally. What do you do? Well, first thing I do is to test the water, number 1. So here are our results. Ammonia is fine, nitrite fine. All these guys, just fine, no problems there. So all these tests were normal. What next? Well, usually I look at a few more parameters. Chlorine is a big one. Sometimes you'll see at very mild levels, you'll see fish that are stressed, not necessarily dying on you. And then we have a copper of 2.2. Well, that copper of 2.2 is probably what's making your fish sick. Copper is highly toxic to koi, and usually anything above 0 can lead to high stress. So in this case, the copper being off the chart is causing the fish to stress out, and then leaving them, their immune system compromised, and then that would develop into ulcers. So, where did this come from? Well, it actually turned out that copper shavings from a roofing project had been falling into the pond pretty much at a constant rate for the last couple weeks. So what the owner did was take out the bottom of the pond, clean it out, perform a water change, and about a month later, all the ulcers had healed because the copper was out of the pond. So I know if you ever see a pond, usually these are in public places that have pennies in them. Always makes me cringe because all those heavy metals, bad, bad, bad fish. All right, so here's our next one. We have an 8-inch koi with ulcers on both sides of its back for the last week. He's eating well, but he kind of is living on the bottom for extended periods of time. Well, what do we do? Again, test the water. Nothing really pops up here, so I'll do my other 2 tests again, and these both came back as 0. So what to do next? Well, this is usually where my cat-dog training as a vet comes in handy, because they pound the history taking into you pretty thoroughly. So, the ulcer appeared suddenly one morning, was very red and deep. So one of the questions I like to ask, are there any predators in the area? Herons, hawks, raccoons, anything like that. And the wife said, oh yeah, there's been a heron standing around the pond last week. He just kind of walks around, doesn't really do anything. It's like, yeah, but that's like a genuine heron mark is right down at the bottom. Those 2 sides of the bill clasping the back. Fish got away, great, but he still has a giant back wound. So, found the culprit here. It's not an ulcer, but it's a bird wound. So in this case, due to the severity of the wound, this was over 1 centimeter deep, this fish was given an antibiotic. Just 1 treatment of Baytril, and he healed up just fine. He actually secondarily might have fractured his back, but unfortunately that is not cured with antibiotics. All right, on to the next pond. So we have several koi in one pond with ulcers. Some are more mild, some are severe. They have come and gone with various treatments. So they've tried potassium permanganate, they've tried salt, they've tried hydrogen peroxide. Usually it'll last for a couple weeks to a month, but then the ulcers always seem to come back. And from this, 2 fish have died, and those usually seem to be the ones with the most severe ulcers. So now we're going to test the water again. Your ammonia's a little high. That's what we call the high normal range. It's not really anything that would cause that much stress in the fish. So we go on to our additional tests, nothing going on. So again, we need more history. So again, we ask the predators. There's no herons, no hawks, no large poles anywhere, no trees. They keep a net over the pond overnight. But the only birds that are present are small starlings that like to nest above one corner of the pond. And looking around, you can see there's numerous bird droppings. In one corner, there's one like piece of slate on the side of the pond that's just a different color because it's so covered in bird poop. Aha! So this is a contaminant that will show up on normal water quality tests. This is just a pond with a really high gross bacterial load. So all of these bird feces have just kind of built up over time, and it's just adding to the detritus and the pathogens that these guys, those fish, have to swim through every day. So this is highly stressful. And this would be why they are more susceptible to the infection. So, solution for these guys, the birds need to be dissuaded. So this is where those pretty little bird spikes come in, just to kind of push the birds over to another spot in the house that maybe they're not going to poop in the pond. So the fish with severe ulcers, those that were over 1 centimeter deep, there are only 2 out of about 5 fish were treated with just 1 treatment of antibiotic. And now that the bird spikes have been installed and the ponds has been kind of cycling through a couple times, the ulcers are finally starting to get better. So now we're gonna skip away from the ulcers, but something else that we have. We have a 14-inch koi with a protruding stomach for the last 4 months. You can see his little picture there on the bottom. Koi aren't supposed to look like that. Koi are susceptible to gonadosarcomas. Nobody really knows why. The only way to go in there and get it is surgical removal. So now we have a quick little video segment. You're gonna watch one of these come out. So we're gonna start this from the beginning. The sound is gonna be coming from here, but it has subtitles. This has some lovely wind chime here.
That you on the right?
Yes, I'm the one in the light blue on the right there. So there you can see in his mouth, he's getting oxygen through that tube there.
He is anesthetized.
Yes, he is anesthetized with MS-2. But you can see there, this is not the same one that we have that picture of, but you can see his abdomen is quite large.
And it's not 8 mil.
No.
Check out the skill so it cut better, cut easy.
Yeah, just so it's easier to cut. And then when I remove the tumor, it'll help close it up, just so they don't have to oppose the scales as much. So all that tissue will just kind of adhere together a bit better. So, if anybody's a little squeamish, you might want to look away.
And I do this, but usually I just put in one of my nice hot frying pan afterwards.
Oh, okay. Yeah, so this particular tumor was about half liquid and half solid. So right now I'm just draining the liquid part so I can get to the solid part.
To survive it?
Yep.
Oh.
So that's the actual tumor. Wow. So now we're just going to rinse them out.
With what?
Sterile saline.
That tumor, is it a part of our intestine or part of a...
It's the gonadal tissue.
Okay.
So male, female, doesn't seem to differentiate all that much. So then, yep, bring them up.
How long does it take for it to heal the wound?
It was only about 11 days. I took the sutures out in 11 days. We'll have an after.
Oh.
So I always like to grab a before and after weight. So we lost 2 pounds.
Oh,
that liquid
wow.
and the tumor.
How long is the operation?
He was only out for about half an hour. We arrived at the property at 2 and left at 3. So he did great.
Wow.
Yeah, so unfortunately there's a little air trapped in him just because he was up out of the water. So now this is the time I'll give him a pain med and an antibiotic just as a prophylactic because abdomens are gross and messy. And unfortunately with fish, it can never be 100% sterile just because they live in water. I could try to glue up the incision, but unfortunately, the glue in fish is highly reactive. It usually causes more of a problem than it actually fixes. So, non-absorbable sutures are in for 10 to 14 days, best case scenario. So there he is. He's awake and he's swimming around and.
Wow.
So we actually have the anesthetic rig, the surgery table, over by our booth. So if you want to check it out, we have a little fake fish you can practice on. So yeah, that is it for that. So, like I said, I usually give antibiotics during the open abdominal surgeries just because it can't be 100% sterile. You never know what's floating around in there. I may give a second dose if the suture removal doesn't look so good, but then again, I've done eye surgery where I've taken an eye out with a tumor and only given them a pain med, not an antibiotic. So, depends on the surgery. But here he is. This is 11 days post-op. I took the sutures out. He's all healed up. This looks great. So you can see all these spots where these scales are. He had an extra row of scales there in the middle. So already the tissue has started to impose itself, which is great. So, in conclusion, all the anti-drugs, antibiotics, antifungals, antiprotozoals, and antiparasitics need to be treated with respect. And know what you are treating and know what you are using, know how it acts before using it. You want to make sure you treat the primary problem first, not just the secondary consequences. And when you're in doubt, get help. We have a good network here. The ZNA Club has a bunch of members that could definitely help you out. And even if I can't answer your question, I have all the other veterinarians at the International Association of Aquatic Animal Medicine, American Association of Fish Veterinarians, and the World Aquatic Veterinary Medical Association. Yeah, there's numerous of them, and we have a large collective between all of us. So right now, does anybody have any questions?